本日は2025年日本国際博覧会アレクシオンファーマ合同会社共催イベント希少疾患の診断ラグ解消に向けてテクノロジーと社会の力で実現するヘルスエクイティにご参加いただき誠にありがとうございます。本講演は会場参加とオンライン視聴のハイブリッド形式を開催いたします。講演は18時30分開始。
The event begins at 6:30.
大変失礼いたしました。本イベントでは発症から診断までに時間がかかる診断ラグをテーマに医師、患者会、AI 企業などの専門家がさまざまな視点から議論し、希少疾患、難病を抱える患者さんの課題解決への理解を深めていきます。本日はスムーズな進行を行うため、登壇者の詳細なご経歴は割愛させていただきます。配布資料にございます登壇者プロフィール、オンラインでご視聴の方は万博の公式サイトをご参照ください。それではまずはじめに、弊社を代表いたしまして、アレクシオン・アストラゼネガレアディジーズ最高経営責任者兼アストラゼネガチーフストラテジーオフィサーのマーク・デュノワイヤより開会のご挨拶をいたします。デュノワイヤさん、どうぞよろしくお願いいたします。
皆さん、今日お集まりいただきありがとうございます。アレクシオン・アストラゼネカのレディーズの CEO を務めますマーク・デュノイヤと申します。アレクシオンは30年以上にわたり希少疾患のグローバルリーダーとして革新的な治療薬を提供し続けます。私たちの医療公平性の意味するヘルスエクイティを重視しており、特に希少疾患の患者さんの負担に着目しています。その一環として、アレクシオンは先週、医療の公平性に関する希少疾患白書を発表しました。このリポートでは、さまざまなデータを紹介し、希少疾患の患者さんに直面する不公平な医療へのギャップを埋めるための解決策を
And I'd like to share with you some of them. Rare diseases, we have about more than 10,000 different rare diseases, and only less than 10% of those have been treated with the available approved drugs. It is a rare disease, so sometimes the health professionals will miss the disease. Also, there's no diagnostic tool, there's not much innovation going on. This is another issue.
We
need to provide the better solutions, and we need to provide the access to the innovative treatment. We have less core hospitals, so this is another issue that we face. The low equity of the patients with the rare disease can be reflected in the cost. According to the recent survey on the disease burden, compared to healthy subjects and disease with a non-rare perspective, so they have more of a cost 6 times higher. And if you look at US, Japan, and Europe, the direct medical cost of the rare diseases account for 43%, 40%, and 65% of the total cost. What needs to be focused here is that you have traffic expenses and nursing care costs. These indirect costs are very high, which can lead to the less of career opportunities and income. So it's not just the direct expenses, but these indirect expenses have to be considered in our discussion.
希少疾患の患者さんの不公平な状態
This inequality
とともに
exists for the rare diseases. We need to understand them. We also need to rectify the situation of a diagnostic lag.
解消することが重要です。
It's important that we get rid of those diagnostic lags.
が存在することで緩和することが
We can reduce this by providing the treatment
開発された領域では
in the area where the development
がされて
has been successful in terms of treatment availability. The diagnostic lag is much better. That the diagnosis is 5 times faster.
希少疾
Alexion is working in the area of the rare disease diagnostic lag in Japan, and we provide 3 solutions.
まず
First of all,
医療診断に AI
we need to utilize AI for the diagnosis.
一緒により溝がされやすい疾患の診断支援ツールとして
AI could be an important tool to avoid missing rare diseases. Number 2,
の全ゲノム
we need to have a total genome testing for all neonates. 85% of the rare diseases are hereditary. Therefore, as much as possible, we need to provide diagnosis and treatment to the patients as early as possible by having a whole genome testing for the neonates. Finally, we need to have a practical patient database where multiple stakeholders can have access to.
患者さんが
We need to make sure that the patients can provide certain data,
診断に
and this could be essential in having an accurate diagnosis.
すると
When we get data,
予防が
then we can see an improvement of the prognosis of the patient. We can also provide support to the patients and could also contribute to the future patients.
これらのソリューションを実現するために
In
は
order to realize these solutions,
に関わる
we need to make sure that all stakeholders related to the rare diseases need to collaborate
とする
and establish an ecosystem.
本日は専門家パネルの
Today,
皆様と
we have experts in the panel who are going to discuss these points, and I should be looking forward to that opportunity. Thank you very much.
ディノワイエさん、ありがとうございまし
Mr.
た。
Denoise, thank you very much for your talk.
講演に移らせてい
And
ただ
now
き
we
ま
would
す
like to move on to the lecture session. The first speaker is
アスリット理事長の西
the
村様。
Director Nishimura of the ASRIT, which is the NPO. ASRIT is trying to provide the services to all the stakeholders in the field of the rare disease and intractable diseases, including the Association of the Patients and the family members and the university researchers, and also the
西村様、どうぞよろしくお願いいたします。
healthcare staffs so that they can provide the services to the patients. Thank you very much. And I am the Yukiko Nishimura,
私は今回の
who is the director of the NPO ASRIT. And my role is to give the introduction in this session. And it is my pleasure to have this opportunity. First of all,
5月の23
today, the 23rd of
患者
May,
そして
is the
大事な日
a very important day for the patients and the family members. 2014, May 23rd, the intractable disease law enacted, and the next year, starting from the January of next year, this law was enforced. And this is the 10th anniversary since the establishment of this law.
記念すべき日に
And in such a commemorative day, it is my pleasure to have this kind of event and have a discussion with the various field of the people
ご存知のことも
in this field.
けれども
And maybe you know, but in the there is a definition of the intractable diseases in this law. First of all, the rare diseases, and also the refractory diseases, and also the long-term chronic diseases which affect onto their daily lives.
イベントでは
So during this event, the one of that on the left hand, the rare disease would be the focus for this session. This field of the rare disease field, the evidence is quite limited, and there is no data available. And also, there are the less researchers in this field. That's as a result of that, that we don't know how to treat or how to cure, and also difficult to treat. So there are so many diseases like that. And also, from the viewpoint of the symptom, not only for the visible symptom, but for the if they have the numbness or the stomach ache, those are the invisible symptoms. And also, there is no treatment at hospital, so there is no solution for these issues. So, not only for the hospital, but they are living in our society as like you. So in such an occasion, we would like to pick up these topics. As I said before, there is the time to take for the proper diagnosis. Sometimes there is no correct diagnosis, or sometimes it is not recognized as the diseases, and also the misdiagnosis would occur. So the upper part is the diagnosis lag, and the lower part is the diagnostic loss. So the diagnostic lag and this diagnostic loss, then we are going to utilize these words frequently in this session. So starting from last year and this year, there is a survey. The 35% of the patients took more than 5 years to reach to the confirmatory diagnosis. As far as I know, there are the person who took 34 years to get the confirmatory diagnosis. And also, there is frequently discussed that we don't have the confirmatory diagnosis yet. So there are so many patients like that. And also, the average of the confirmatory diagnosis, it took 3.4 years, which is not so short at all. So, and also, there are the patients who experience the misdiagnosis. The 60% of the patients experience that. And whether they have the experiences of the misdiagnosis, well, until the proper diagnosis is made, they don't know whether this is the misdiagnosis or not. So only the patients with the confirmatory diagnosis, they can respond to this question. Some of the patients are not receiving the genetic test, as well as they haven't have the proper diagnosis yet. So there are so many patients like that. So the diagnostic lag, this duration, as it is shown in this graph, the medical expenses quite high, and average the hospital visit stays quite frequent, and also the many hospitals that they have to visit, there are so many. So, which means that the QOL of the patients, the quality of life, comes to be affected. On the left-hand side, this is the patient with the rare disease. On the right-hand side, this is the patient with the diseases, which is not the rare diseases. So there are the 34% difference in between these two. So if you imagine that all the way you may feel some symptoms, but there is no diagnosis, then as they can't receive the diagnosis, that's why there is no treatment given. So this is quite a difficult situation, and that is affected directly to the patient. So the QOL comes to be lowered, and as a result of that, which is shown on the right-hand side, if they are trying to do the new challenges, the motivation would be affected. They wish to change their job, or to challenge the new job, or to meet with a new person, or to invest for the future, or to do the work very hard for the study. There are many challenges that you can think of, but the current situation, they haven't have the confirmatory diagnosis yet. That's why the QOL is not increased, and so as a result of that, such kind of direct effect or impact would be given to these patients. Unfortunately, this situation cannot be well understood by the others, and that is not well communicated. As a result of that, stigma or the prejudice would occur.
このようにですね、
So,
希少疾患の領
in
域
this way,
診断が
in this the rare disease field, the diagnosis lag and diagnosis the loss would be frequently occurred.
で終わるのではなく
But
やはりこの課題が多い
there are the challenges based on that. And so, how we have to consider how to overcome this and how to come up with a solution.
どのようにチーム
And so, how we can take the teamwork so that we can look for the solution. So this is the point that we have to consider.
解決されていて
And if the challenge is solved, and if there is no necessary to discuss, then such event would not be organized. So if the challenge is identified, then we would like to have the discussion together with you, and that is very important. And also, for the sake of the discussion,
建設的な議論
well, we have to come up with a productive discussion, not keep it as the discussion as it is.
こういった課題
So,
に
for these challenges,
患者側だけ
and
医療者
only
側
by the patients, only by the hospital HCPs, and
それぞれの
only by the government, that we have to consider for these stakeholders and have the communication among them so that they can think of what they can do for each of that, and so that we can come up with the solution, and that is very important.
今回のパネルディスカッションでは
During this panel discussion, excellent speakers are coming up on the stage. Dr. Takenouchi, Dr. Muto, and Dr. Yamano, from their own perspectives, they are going to give the presentations to us.
またパネルディス
And
カッショ
then,
ンからは
at the time of the panel discussion, the viewpoint from the company, private sectors, the Hamamura-san is coming up, and for the patients group, the Oguro-san is going to talk. So we would like to have the productive discussion with them. So with this, I would like to conclude my talk. But actually today, there is a guest from overseas, and from Taiwan, the Taiwan Foundation, the Rare Disorders, the executive director, Ms. Ruth, is here with us. So I would like to ask a comment from Ruth.
about diagnosis lag or loss, especially in Taiwan. すみません、今怒られました。どっち日本語で言った方がいいんですかね。どっちがいいんですか。なんかでも日本語で言えって言われたのに私のあんまりフルエントでない英語を喋ってもしょうがないので。
So I should speak in Japanese. I'd like to ask Ruth to talk about diagnostic loss or diagnostic loss and lag.
台湾ではどのように
How is the situation in Taiwan? And
TFRD として
what does TFRD contribute for this lag and loss, please? It's going to be a consecutive translation.
逐次通訳をご用意いたしますので、日本語でご聴講の皆様はそのままお聞きください。
And this is going to be a consecutive translation. Those of you who are listening to Japanese, please stay tuned.
Thank you. Thank you for inviting me here. And in Taiwan, the experience about diagnosis is pretty much the same, just Yukiko said. Just recently, we have a survey for 400 patients in Taiwan. So we found that about 40 patients show their symptoms before age of 1, but they got the confirmed diagnosis maybe after elementary school or when they have kindergarten school. So maybe there is a gap between the symptom and then the final diagnosis. So pretty much the same situation in Japan. So according to our experience,
すみません、通訳をお待ちします。台湾におきましての診断ロス、そして診断のラグということですけれども、最近行いました台湾における約400人の方の調査結果を見ていきますと、40人の方は1歳未満の段階ですでに症状の発症があるにもかかわらず、確定診断に至る年齢が幼稚園であるとか、また小学校に入ってからということになるということで、実際の症状の発症段階から最終の診断が下りるまでかなりのギャップがあるということ、これはやはり日本と似たような状況だということが言えます。
Yeah. So additionally, in Taiwan, rare disease patients must be reporting by doctors to our government. So in order to use the orphan drug, when health insurance will cover their drug, so the report must be including accurate diagnosis. So including genetic testing report. So therefore, the accurate diagnosis is the first step for availing subsequent service in Taiwan. So that's the situation.
加えまして、台湾におきましては、希少疾患の患者さんに関しては、医師から政府に報告をするということが必要となっています。それによって初めて希少疾患治療薬、オーファン薬の保険償還を得ることができるということです。したがって、この医師からの報告に関しましても、正確な診断が必要であるということで、遺伝子の検査もこの中に入れられて、正確な診断がつかなければいけないということ。以上が台湾での状況です。ありがとうございました。
Thank you for your valuable comment. 以上です。ありがとうございました。
西村様、ありがとうございました。
Thank you very much, Ms. Nishimura. Now we would like to invite the next speaker from the Okayama University, the medical and dental, the pharmacology area. Professor Takenouchi is going to be talk, and he is identifying the pathology and also the etiology. Such kind of research is conducted by him. And also, as for the severely neonate, the whole genome test is utilized, and that is applied for the AMED. And he has been participating the Korean the Child Neurology Society meeting. So he is he is going to give us the lecture through the web. Now, Professor Takenouchi, would you start your presentation?
よろしくお願いいたします。
Thank you very much. I am Takenouchi from Okayama University, and the May 23rd is the Rare Disease Intractable Diseases Day, and it is significant to have this event today. And as the diagnosis lag and loss of the rare disease, that is the topic. And as the doctor who is taking care of the pediatrics, what kind of activities is taken place so that we can come up with the diagnosis as soon as possible.
希少疾患というのは非常に
Talking about the rare diseases, there are so many, thousands of the rare diseases are existing, and that we don't know the etiology of the disease, and that is the most difficult part, especially for the treatment.
お元気になっていただくと。
And the child has to be brought up in a healthy manner, but the diagnosis at the early phase is very important for that purpose. So once the baby was born, that is the earliest time. As it is shown here, there is no other baby without identifying the disease. But basically, the healthy baby is born. But if not, then the NICU is the place where the baby is brought in. And at least 10% of the babies are suffering from the genetic diseases due to the disorder of the gene. And if I talk about the babies, the symptoms is not so significant. So sometimes we recognize that they are not healthy and not energetic. So it is very difficult to come up with a diagnosis visually. So in such a case, the gene information is very important by identifying the gene screening. And without knowing the etiology or the cause, it is very difficult to come up with a diagnosis. So this is the one that I'm trying to be involved. I was talking about the gene, and that is regarded as a blueprint of the body, as it is shown here. The genome, that is the blueprint of the body. And where is it existing? There is a body, and in the body, the organs, heart or the kidneys. And if we see in detail, then the tissues, the connective tissue, the connecting, and also the epithelium. So these are the tissues. And if it is further get into the detail, and the cell, which looks like a ball, is get together. And there is the switch on that, and in that there is the thread-like scene, and that is the genome. And what is the structure of the gene? The gene, that is the level, that is the unit for the certain work. So the certain gene is working at the kidney. Some of them are working at the hepatic work. So there are about 2,000 genes, and that consists from the genome, that is the DNA, which is the line of the letters. That is about 3 billion of them. And only one place is replaced with the other, and then the very severe symptom would occur. So it is rather difficult to see where the disorder occurs, but it is very important to identify what is the missing part or the disorder of the genome. And starting from the 2004, the new technology has been introduced so that the genome screening is done to identify the disorder of the neonatal. Even those the well-experienced doctors or the pediatrics sometimes difficult to identify. So those patients are participating to this study, and the sample of the blood was drawn as a sample, and from the leukocyte it has been identified, and half of the subjects were found out that the congenital disease occurs. Many of them are the rare diseases. And after these diagnosis is made, of course that is very important, but that is not sufficient yet. We have to identify how this data is useful. Then the at the early stage, diagnosis can be made. So half of them were responding that the early diagnosis is very good for the future treatment after finding this abnormality. So the rare disease means that it's very rare, and many of them are the genetic diseases. And the one cause or there are two causes, many of them, and also not all the diseases, but we are getting into the era that we can cure those diseases, and this is the spinal muscular atrophy. SNN, the gene is abnormal, and then there is no, the spinal muscle is not made, and then they cannot take the power. And if the treatment is not given, and then the half-year-old baby would getting into the death. So in this body, the SN1, and there is another SNM2 in the body, and usually this gene is not used. But we are trying to, there is a drug which can make this SNM2 works. And by doing so, and then the muscle and the neural, the nerve can be activated. So such treatment can be done. And with the other disease, the same the gene is not is not existent, but it can be produced with the same the gene and then replaced with the man-made gene with the abnormal gene. And currently, I was talking about the very severely affected disease, the babies. But for in the Western countries, the genome screening, the whole genome screening is the aimed or conducted for the healthy child, and it is possible to identify the whole genome, and then the purpose is to identify which are the gene which causes such diseases. So it's not all for the genome, but for the there are the hundreds of the diseases which has the treatment method. So they are trying to come up with this the identification. So this is my summary of my talk. The genetic diseases which can be treated has been now it is increased, and prompt genetic diagnosis is very important. And also the subject with or without disease onset, I think it is important to distinguish them for the screening. So for the severely sick neonatal, with the whole genome analysis, the half of them can be identified, come up with a diagnosis, and half of them can be treated. So I think it is important so that we can come up with a society to continuously to conduct this research as a whole country. Well, thank you very much, Professor Takenouchi.
And next, we'd like to invite the chairman of board and CEO of Integrity Healthcare, Mr. Muto Teacher. Integrity Healthcare aims for the medical tech. They provide online therapy, digital therapy, and personal health record. They utilize digital technology to promote new medicine. Now, Dr. Ito, please. Muto, please. Thank you for the introduction. I am Muto. I am a cardiovascular specialist. I believe that digital can change the medicine, and as a result of that belief, I'm serving as the CEO and chairman of this company. The diagnostic lag is the theme of the event. From a doctor's perspective, I like to speak about what doctors think and what is the reason why the diagnosis of rare disease is difficult. Unless you are a specialist outpatient ward, if you have an outpatient in front of you, you would ask questions. And when you ask questions and get the answers from the patient, you would usually think about different possibilities. And normally, you have top three. You listen to the symptoms, and you would think of three possible diseases. Among the three, we will try to think which one is the case, because these three can cover more than 90% of the diseases. On the other hand, although we think of the three possible diseases, these are also some diseases that you should not miss, like the dissection of aorta, or you have the heart attack. We don't want the patient to go home and suffer. So there are certain diseases that you should not miss. So there are three others in this category. So this is how we try to diagnose a patient. And if you spend a lot of time and have all tests, you can identify the disease. But in your day-to-day practice, you cannot do that. You don't have time, and the patient would also complain that there are too many tests. So when it comes to a rare disease, as you may know, at the beginning, you don't start with the clear-cut symptoms. Of course, things may differ between children and adults, but in our case, if you have a heart failure, there are rare diseases that cause heart failure. Sometimes patients feel tired, difficult to get to sleep, or sometimes can easily become out of breath. But there are many diseases with the similar symptoms. Then the question is whether you would first suspect the rare disease and have tests. Frankly speaking, you don't do that. And as a result, you get the diagnostic lag, which is quite an unfortunate situation. So the question is whether we can do anything about this. And my topic today is that there's a way moving forward, and that is where the technology comes in. When iPhone started to be used, it was in 2007. That was quite a long time ago. And recently, you have generative AI. One of the representative tool is ChatGPT. That is the 30th of November 2022. It was just 2 years ago. But many people already use these. So the way we do work or what way we search things have been very much changed. So the question is how we can utilize this new technology in medicine. In the ordinary practice, you may miss certain diseases, but with the use of new technology, there may be something that we can contribute. So that's the starting point of what we think of. So when it comes to the identification of a rare disease, how can we use AI? Let me briefly explain that. Of course, when you listen to patients, there are answers that you get from the symptoms. Sometimes their responses may not be characteristics, but if you combine all these answers, then you may think of certain disease. They may not be in the top 3, but there may be a kind of disease that require good diagnosis, although this may not be immediately fatal. And it's rather difficult for a human to be successful in doing this, so you can use AI because it has an enormous data. And with a certain pattern that the patient complains, then sometimes there's a complaint, sometimes you don't have a complaint. So if you look at all these different patterns, then you may suspect a certain rare disease. You can get that message from AI. That's one of the better things that the AI can do. And pattern recognition is something that AI is very good at. So if you suspect of a disease, you may have CT or you may take MRI. And when it comes to a rare disease, because it is rare, it's rather difficult to find some features in the image, and you may miss them. For an ordinary doctor, the findings is very rare that you may not see them. But because AI has already learned tens and thousands of images, then AI can give you a hint, a clue of a possible disease. This is something that human cannot be successful, but the AI can help. If you think of the medical information, suppose you have a hospital and you get there and you get the test result. You also get the result of the screening at a certain hospital. So your data is scattered in many different sites. And it's very difficult for all of these data to be gathered and integrated. And a single doctor cannot gather all the data of the patient existing in so many different sites. But as you know, AI can gather this distributed data and can analyze that. It's possible. So this scattered data can be integrated, gathered, and collected by AI, and AI may give you a point of focus. So AI does have so many possibilities. Another thing is that SAMD, this may be something that you have not heard before. That's the software as a medical device. It's SAMD, SAMD. In Japan, we call it the programmed medical device. It is a software. The software is utilized for the diagnosis and therapy. In 2014 in Japan, this was approved, and this is now utilized in the medical practice. So you have AI, and the question is how we can utilize this. You maybe in a form of app, or maybe you have a system or software that is connected to the patient e-record. So we have much SAMD being used. For example, when you actually use AI, you need software, or when the patient is remotely aware, in order to provide a good diagnosis, then the doctor and specialist doctor in the large city and the patient may be connected. So this kind of remote medicine is increasing. In the past, you had to visit and actually see the expert doctor or specialist doctor face to face. But now with the use of digital technology, you may be able to provide a diagnosis in a remote manner. In the overseas, you take facial photo of a patient, and AI can point out some possible rare diseases. That system is already available overseas, but there are many new opportunities that are being actually used in the medical field. Of course, there are challenges. Because of the rare disease, you may have difficulty collecting data. Because the number of patients is very small, just by showing the data, you can identify the patient, or there may be information leakage. So the security and medical ethics, there are challenges in these areas. So we need to solve these problems. But the technology that you use on a daily basis, by applying that in the rare disease, we may have a brighter future. Thank you very much.
Dr. Muto, thank you very much for your presentation. Then lastly, I would like to invite Professor Yamano from the St. Mariana Medical University Neurology Department. And Dr. Yamano is taking care of the patients at the neurology department, and also he is the center lead for the genome medical treatment in the same university. And also the intractable disease platform, which is the common information integration basis for the individual intractable diseases, which is supported by the MHLW and AMED. And also he is promoting the collaborative research as well as the international collaboration as well. Dr. Yamano, please. Well, thank you very much for your introduction. I am Yamano from the St. Mariana University. And today, we would like to talk about how to overcome the rare disease and intractable diseases by utilization of the patient data. And this is my self-introduction. I am the researcher of the HAM. I was studying under Dr. Osame, who discovered this intractable disease as HAM, and that was my starting point. And at the time that the HAM, the patient organization, was established, and then I started to participate, that was the 2003. And in Kanto, Tokyo area, I was assigned to the Tokyo area, and there there is the patient organization of HAM in Kanto region. That's why I was participating there. And by request from the patients, well, they are trying to come up with the specialists, and it is really difficult for them to look for the specialists. So I start up the specialty department of the ham, and we conducted the research as well. But still, it was difficult to conduct the research, so I set up the ham patient registry. So I believe that many of the patients of this disease are participating for this event, and if you participate at the patient organization meeting, and then at the time of the consultation at the hospital, it is really time is quite limited, so it is really difficult to get the true feelings of the patients. But by participating this kind of event, the patients organization meeting, I can get the real voices of these patients. And these are the common issues for the rare disease and intractable diseases. It takes quite a long time to get the diagnosis. And once the diagnosis is made, but the doctors at the hospital are not showing the interest to my disease. And also, if it is so, and then I was wondering where I should go to get the treatment from at the hospital. So even though I decided to go to the specialist, but at this moment I haven't received any test or the treatment yet. And these are the rare disease. So the process of the disease and what kind of symptoms would occur, even for the patient and also the family members don't know that. But still, the disease progresses, and they have the burden in the physical burden as well as the expenses of the medical expenses, and also in their surroundings, they don't see any similar patients. That's why they are very anxious, and also the symptoms progresses. That's why the patient was saying that it is really difficult to lead my life. So these are the common issues that the patient with the rare diseases, intractable diseases. So to solve these issues, the patients are saying that we need the development of the drug. But as far as I alive, maybe it is not possible to get the cure. But for my next generation, we would like to contribute so that the future generation won't suffer like me. So together with the patients, I visited for the MHLW and also the diet as for the petition. And also then, as a result of that, 2009, the ham was designated as the intractable diseases. And in this Kanto region, a specialist department was organized, but the same whether the similar treatment is given nationwide. This kind of information has to be collected, but we don't know where to collect this information. So from that perspective, I can say that it's really difficult to deal with the rare diseases, because on the right-hand side, the doctor and the patient, that is the side of the hospital, and that the scene has to be further improved. And in order to have the cycle of this, the samples are to be collected and stored in a proper way, and then the research would be started, and then the possible, we can call it as seeds. We have to find out the seeds of the drug, and then on the left top, we have to collaborate with the private sector and the academia, and clinical study has to be conducted. And if the good result is obtained, and then evidence can be created and guideline can be created, and based on the guideline, all the doctors throughout Japan, the best treatment, or by following the guideline treatment, would be given. So this is very important. In the case of the rare disease on the right lower, the patients are scattered throughout Japan, so it is really difficult to collect the information, and the sample cannot be collected. So the candidates for the drug is not developed, and if there is no candidate, the clinical study cannot be conducted. And once this seed is nurtured for the drug and the clinical study is to be planned, then how we can evaluate whether the drug is effective or not, because there is no the information how this process, the disease is progressed. So the MHLW as well, the government doesn't know how to assess this. So the data of each individual patient should be collected so that the data has and the samples, the specimen, as well as the gene information has to be collected, and then that is the starting point, and to have this circulation. So in 2012, the HAMNet was started, as it is shown here. The HAM, the patients, throughout the nation, as it is shown here on the map, there are the hospitals which these patients can be taken care, and so the patients started to recognize where to go. And also, many information, the patient's informations are collected, and this is the most or the best the database of the patients in the world. On the left hand, from the patient, data is to be requested to be utilized for the research purpose. The researcher they would conduct the research, but of course, not only that, we have to consider how to provide the drug to the patients. So this data should be utilized by the private sectors, the pharmaceutical companies, for the development of the drug. And if there is the informed consent, and then we can provide this information to the private sectors as well. Once the HAMNet was started, in the 2000 years, in the 2000, the diagnosis of the HAM, the duration till the diagnosis took 5 years, but in the 2010 years of 2010, that was shortened to 2.2 years till the diagnosis is made. And also how the progression of the disease would occur, depending on the patient, it varies. But if the data is available and the statistician and mathematical specialist can work together, then we can come up with the proper treatment which is meeting appropriate for each individual patient. And also the biomarker, the useful biomarker can be discovered, and also the seeds of the drug can be found. And then the IP would be created. So the evidence is accumulated, and then the guideline can be created. And once the guideline is available, and then the interest of the public would increase. So the patient registry, I would like to prevail this registry throughout all the intractable diseases, and it is supported by the MHLW and also the AMED, the intractable disease platform. That is a research organization. It was started in 2007, and in Japan, for the MHLW come up with the organization so that they can cover all the intractable diseases. And so this is the purpose of the coming up with the intractable disease platform. And the half of the designated intractable diseases is based on this platform. And even though there is even though the support of the intractable platform, the vaccination, but there are some registries. So if it is at those private registries, more than half of the rare diseases can be covered. On the left-hand side, the registry supported by the intractable diseases platform, and then that means that the private sector utilizes this the data. So that should be further promoted for all the rare disease and intractable diseases. In order to change the situation, the patient registry would be the very effective tool. And also the rare disease number of the patient is quite limited, but each individual experiences of the disease would contribute for the movement of the disease. So the registry can be described as the integrated information or the for the with a record of the diagnosis and treatment and prognosis of each individual patient. And also the SAMD, as I mentioned, and also the AI learning basis would be also based on this registry. And also the pharmaceutical companies can utilize this activity, and then the drug for the rare disease would be further developed. So in this way, it's not the simple database of the patient, but it can be described as the basis of the hope. So each individual data would change the future. So I would like all the patients and the family members would understand, so that this would be further talked about among them, so that we would like to increase the members to create the future. Thank you very much.
山野先生、ありがとうございました。
Dr. Yamano, thank you very much.
パネルディスカッションを行います。
We are now going to have a panel discussion.
残っていただき、
Dr. Yamano, you can stay on the stage. May we invite Nishimura-san, Okuro-san, Professor Muto, and Hamamura-san.
もうしばらくお待ちください。
May we ask the audience to wait for a few moments.
お待ちいただきありがとうございました。
Thank you for waiting.
ディスカッションのテーマは
The topic of this discussion resulting diagnostic lag and looking to the future. Let me introduce our speakers. In this discussion,
を務めていただき
the moderator is Nishimura-san, who gave a lecture earlier. We also have the Japan Council of Associations for Intractable Disease and Disorders, JPA, President Mr. Daiko Okuro joining us. The JPA aims to create a society where patients with intractable disease and their families can live in peace. They propose,
制度のあり方に対して
they propose for national measures against intractable diseases, and they also
フォーラムを
have a national forum on intractable and chronic diseases to provide voices of patients to the society. We also have Dr. Muto and Dr. Yamano
オンラインにてご
to join us. We also have Dr. Takinouchi online to join us.
合同会議
And on behalf of
本ディスカッション
Action Pharma, President Hamamura is also joining. Now, Nishimura-san, you have the floor.
ありがとうございます。
Thank you.
それではここからパネルディスカッションを
We now like to begin a panel discussion.
お伝えしているように、この
As we have been discussing diagnostic lag or diagnostic
考えて解決
laws,
していく。
how can we resolve these issues? There are several points that we like to focus our discussion on. First of all, Oguro-san and Hamamura-san,
参加されている
those two speakers are joining us from the panel. So if we could just ask you to briefly introduce yourselves, and also
お聞きになって
if you can pick some of the points on the screen and share with us your comments. Ogura-san. Yes, thank you. I am Ogura. I have a collagenous disease. It's been 25 years since I have been suffering from this disease. I'm from Osaka. I came from Sakai. We often talk about drug lag, but now we are talking about diagnostic lag after we started discussing drug loss. So the words are important. Diagnostic lag. I started to use this term several times a week now that this topic was introduced for this discussion theme. So we do have such a lag, so we have to really seriously tackle this issue. Thank you. Thank you. As you loss, some people may consider these are the things that are not happening to them. But what about diagnostic lag or diagnostic log? Perhaps some people may have a similar experience. Yes, I also serve as a consultant, so some people do have much anxiety over the fact that the diagnosis is not confirmed. Of course, treatment is important, but people cannot get into the treatment stage because they are not diagnosed. Sometimes they do not get the right treatment. So diagnosis is very important for the patient. So we really have to think of this seriously. Thank you.
では引き続きまして浜村さん。
Hamamura-san, if you could introduce yourself and share with us your comment.
はい、ありがとうございます。
Thank you. From Alexion Pharma, I am Hamamura. I serve as the president in this commemorative venue of Expo, and on the day of intractable disease, it's quite an honor for me to be able to take part in this forum. Open-san talked about drug log and drug loss. These are really an important challenges for us as a pharmaceutical company in the area of a disease. Diagnostic loss or lag are the areas where that we as a company really have to tackle to provide a better treatment and therapies to the patients.
ありがとうございます。
Thank you.
そうですね。このディ
Yes.
スカッションの中でも
In this discussion,
できることは一体何なのか。
we should know what
それぞれ
companies can do,
と
what individual companies can do, and also what an industry with the collective companies can do. So I think there are two layers, and I'd like to get your comment on this later.
それ
Thank
で
you.
は今スライドの方に
So on the slide,
ディスカッションのテーマを一応3つ
we have 3 discussion topics.
との打ち合わせの中で
We decided on this in advance
考えた
as a result of our discussion with the participants. First, about the initiative for the
ディスカッションしたいと思っております。
genomic testing. That's the first topic I'd like to discuss with you. Dr. Takenouchi, perhaps you can start on this topic.
いらっしゃる方々、今会場の
The audience here, we have a full house,
されていて、
online viewers, and
を見る
can you also talk about advantage of looking into the whole genome sequencing
見る全ゲノム
and this whole genome sequencing? How can we promote and make it more available? What are the challenges in making this available? Dr. Takenouchi.
はい、
Thank you.
させていただきます。
Yes.
ですね、全ゲノム検査という
When it comes to whole genome testing, before we talk about that,
ところで
testing of a genome, I mentioned this earlier.
調べるのと症状の
People with symptoms and people without symptoms, we need to separate these two.
で、診断症状がすでにある方っていうのは
Those with the symptom,
が出ましたけれども、
when it comes to diagnosis, because of the symptoms, we can identify the cause of the symptom. And that's how we move forward. But when it comes to those without any symptom,
現状は
and then whether there is a genetic disease or not is the starting point. So
考え方が非常に変わってき
you
て
have a different perspective and different way of thinking.
検査自体
So the whole genome testing itself may be the same, but the objective of having the test is different. When you have whole genome analysis,
はできるんですけど
you can look at all the genomes, but
今ですね
in reality,
あるところっていうのはその先ほど電
there
子
are certain
ところに多く
exons where the diseases are related to.
て
In addition,
構造異常の不足によっ
you
て
have structural
拾えない
abnormalities
起こっているところを見る
which you need to identify as a cause of disease. So what I'm trying to say is that
では
the objective is not to cover all the genomes,
その予防のあれですね無症状のない
and
っていう
for
と
those without any symptoms, you focus
いうと
on the diseases of 100 diseases, so it's not the whole genome that we focus on. But on the other hand, people with the symptoms, we have to look at all the genomes to find out the
あるのでちょっとその
causes. So I think these two are different.
ちょっとですね少しちょっとまた細かい話になるんですが
And it's a detailed thing, but
的なことを
as the preventive manner, the neonatal screening,
ご本人だけをしない
the
なるんですね
the patient themselves are studied, but those with the symptoms, then the parents were also analyzed. So for the three of them, that's why it is easier to identify the diseases. But in the case that we just conduct for the neonatal themselves, with who don't have the symptoms, then it is really difficult to identify whether this patient has the diseases or not. From the perspective of the patients, the whole genome test or analysis, there may be some impression that everything is to be tested. But according to the Professor Takenouchi, if the patient has the symptom, and then it is very useful to conduct the whole genome tests. So we have to be careful to talk about the whole genome the test to whom that we should apply with. So in this topic, at the time of the preparation, the diagnostic lag and diagnostic loss, for the solution of them, technology and also the understanding and also the ethics, and these are very important. And in that, the whole genome analysis, the technology, from the perspective of the technology, it is well advanced. But Oguro-san, the understanding, I was talking about the impression or the image of the whole genome analysis. Well, that's very important. So what is the purpose of the genome testing? So without knowing that is the situation of the patient. They don't know the purpose of them. The medical staff can understand what is the purpose of conducting the genome analysis, but even though they don't know what the etiology is, but that is very important. But it is important to explain to the patients what's the purpose of conducting the genome analysis. So it's not the understanding level, but further, it is well penetrated. Not just the patient has to buy the concept of conducting the gene analysis. So this issue, well, unless the patient can fully understand, then they can agree upon. So that is very important. I wonder whether that properly explained or not. I think that is very important. Well, thank you very much. Then Dr. Yamano, the government, the whole genome analysis plan, and they are focusing for the intractable diseases for the testing. Well, I was talking about the technology and system and understanding and ethics. So the system is important, and Oguro-san mentioned that the understanding is important. From your perspective, Dr. Yamano, regarding for the whole genome analysis, what do you think about the approach that the Japan is taking place? Well, in what way we have to promote the understanding of this test? Well, thank you. Well, with the Honebuto policy, maybe you know, that is the basic policy, and through as from the government, this genome has to be utilized for the medical purpose, and this activity, one of the representative example is the whole genome analysis plan, and this plan is established, and based on that, the research group. They are covering the whole the intractable diseases, and there is another research group who is taking care of the cancers. So for this research group, they are trying to come up with a system so that they can conduct the whole genome analysis. Actually, the system has to be well established already, but that should be applied in and penetrated into the healthcare. In what system, how the healthcare should be incorporate the genome, the analysis. The patients refer to one place and then refer to the other. Then I think it's very tough for the patients. So for the how this should be incorporated with the current system is the topic that this research group is discussing. And the data is once created, and then it should be returned back to the patient, but it is really difficult to establish the system or the major institute to let explain to the patients, and that is also started to work on. So just steadily that we are trying to penetrate the whole genome analysis. Well, at this moment we are still at the phase of the research level, but in the future we are planning to get into as for the policy of the government. And then talking about another point, that is the understanding, the patient themselves and also the family members and the society. The genome care, not only for the genome-based medical care, but once the data is accumulated, and that is has to be reflected into the development of the new drug. So that is also included in the whole genome analysis research group. And we have to get the public understanding of that. And I feel the hurdle. In UK, the genomics the project was conducted, and I believe that by utilizing the various tools, it has been promoted. And the research group in Japan are trying to invite the patient association and also the doctors to come up with the similar activities like UK, but that is not simple. And that is the current status. So from the various aspects, this point should be discussed and to penetrate the good understanding to the public. So like Dr. Takenouchi and for the others talk has to be heard by many people and penetrate into the society, and that is very important. Well, thank you very much. And by utilizing for this information, and then the future would be the improved. But even though the research group is established, but it is not yet promoting the good understanding.
So is my summary right? To improve medicine, we need a structured system. Like you need to educate doctors, and you also improve the quality of the genetic counselors. Also, it's not that everyone can be diagnosed. So For patients who did not get a diagnosis, we have to promote research so that people can be diagnosed, and we have to gather data for that. And that data can also be used for drug discovery. And we need to get consensus, not just among the patients and patient family, but the people in general must have an understanding. This may be a little bit different in terms of the perspective, but we need to have a deeper understanding, particularly among the general public. That's the area where we need a further effort.
ありがとうございます。
Thank you very much.
ではない。だからやらない。
It's not simple. That's why you don't do it. No, that's not the case. But because it's not easy, we have to tackle it. Dr. Takenouchi,
ではないという。
it's not simple and easy, as Dr. Yamano mentioned.
じゃあ反対に
And then
ようにすれば
what can we do
されたり
to have a better understanding among the general public? How can it make this something positive in terms of how people can accept, and what can promote more active participation from the medical field?
やはりですね、その技術が
When it comes to technology,
っていうことを感じる場面が多い。
there are areas oftentimes where we find technology quite useful, and we have to communicate that message to the general public in easy to understand manner. That is our responsibility. We also need to ask the industries, companies to communicate, and we need to create more opportunities for working together in this area. Thank you. Thank you.
実はみんな
I
で
think we all need to work together, because on individual basis you may not be able to have a better opportunity. So we have to continue providing an opportunity for people can communicate together. We first need to understand that we have a useful technology here in Japan. With that understanding, we need to make further efforts to move forward. So next, about the promotion of the use of AI diagnostic supportive tool. So Hamamura-san, from a pharmaceutical company point of view, this tool to support the AI diagnosis, how do you look at this? So both from the pros and cons, if you have any positive side and also challenges, please share with them.
AI 診断支援ツールというのは
So AI diagnostic support tool for the area with the low level of diagnosis, when even if we have a therapy, we have difficulty actually reaching out the patient. So this tool may be quite powerful. In Japan, we also compare different medical system in Japan vis-a-vis the rest of the world. In our company, people think that the Japan has a high level of medical system, and this applies to the stage where the diagnosis is confirmed and treatment begins. Japan still has a lot to do in the area of diagnosis. And if you look at some D environment here in Japan, the PMD approval is increasing, but it's rather difficult to get them reimbursed. So the actual usage, we still have many things to overcome. So pharmaceutical company and the AI diagnostic support tool manufacturers can collaborate with each other so that we can provide something that is better and can be easily accepted in the medical field. Thank you.
診断ラグということを考えると
When we think of the lag of diagnosis,
AI の診断支援ですよね。
the
支援するツールが
tool
ないよりあった方がいい。
that is used for the diagnosis with the use of AI, it's good to have, and I think there's a value for the patient. So Oguro-san,
診断支援ツール
this AI diagnostic support tool do you have a positive image, or do you still have an impression of a negative thing? I think the support is important, because in the end it is the humans to make decisions. The question is what kind of support and assistance we can get, and if we have a good focus on that, I think that's good. If AI wins, and if you are completely dependent on AI, that's not a good medicine, I believe. So at this point, we are in a transition stage, so we have to have a good thinking over this. So we have to make sure that it is a supportive tool and make use of that.
ありがとうございます。
Thank you.
AI 診断ツールではなくて、
So it's not AI diagnostic tool, but it's an AI diagnostic support tool. And this support, I think, is very important.
当先生、
So Dr. Muto, I have a question to you. As Hamamura-san mentioned, it's not very well penetrated here in Japan as a challenge. From your perspective, AI diagnostic support tool in Japan,
あればいいんではない
what do you think is the infrastructure that is needed to promote the use of this assistive tool? Thank you. I have been listening to the discussion. I believe this has been very interesting, and this assistant or support side is what we need to emphasize. And I think there are two aspects as we make this more useful and widely used. So we first need to aggressively show the evidence that it has a merit of using this. The advantage is that it's easy to make a diagnosis. That's of course important, but you all need to look at the enhanced QOL on the part of patients. And sometimes we often suffer from the shortage of labor. So even with a small number of people, if we have a good diagnosis and therapy, then even this is not something a direct contribution, but with the use of AI, if you can provide a convenience, you really have to show that as an evidence. That's the very important first step. And the second point is that the understanding is the next stage. Both the medical professionals and the patients must understand this convenience and its a positive aspect, and that this can lead to a better diagnosis have to be understood. As Ogura mentioned, people have over-dependence on AI. Sometimes people have quite a negative impression. So I think we need to reconcile these different views to have more opportunities to use this and have a better understanding. That I think is important. And in order to use this, as it was mentioned, the reimbursement by insurance, a certain kind of support is also needed to promote the use. It's not just in the medical field, but when you have something new, you may have a psychological barrier in the real world. So we have to have something to overcome that to break the status quo. It's not just the money, but for the promotion of the use, you need a better understanding of the general public and understanding of the professionals.
And I was talking about the defense as well, the security issue, and also the medical ethics issues. There are so many things that we have to consider. In Japan, when something wrong happens, and then everything is denied, and we stop, they stop the progress. So especially in the field of the rare disease, intractable disease area, well, by collecting the data and make the analysis, and that is the basic use of the AI. So the data governance and also the data management by following the international standard, and these 2 points are very important. Well, thank you very much. So from the view, the offense and defense, 2 aspects are very important. So in that case, well, I have a question to Dr. Muto. So in order to keep the defense and offense, and in order to promote for both aspects, if you are in the government side, and if there is the point that you request, what is do you request? Well, I am involved for the SIP project. I am assistant from the program director of the support of the AI use. So the government is quite eager to promote, but the actual on-site activity and efforts and the effort is not well appreciated. Well, the doctors these days, they are spending all their time to take care of the patients who are in front of them. So in order to add their activities, there are some incentives should be given. Well, and also that we have to eliminate some work burden. So the work burden at the medical care area has to be loosened or decreased, and that is important. So technology is now available, and also the systematization is important. So not only to come up with a system simply, but the new challenge or new technology are to be introduced into the medical site. It has to be considered how to let them utilize these technologies. Now the question to Dr. Takenouchi. So I know the individual doctors are quite busy, and then the medical society is also important. So the kind of the sum of the doctors or organization of the doctors, is there any action that they can take toward the government? Well, thank you. So at the field, we have to communicate the field condition to the authority. And unless the medical society is involved, then it is really difficult to come up with one voice. So in that sense, the medical society has the important role. And well, of course, the individual hospitals may have the different the ideas. So in order to summarize what they wish, it has to be summarized by the society. Well, so the same thing can be applied to the patient association. If the individual request is requested to the government, it cannot be heard. That's why, especially in the field of the rare disease field and also the intractable diseases, it is important to let the organization to summarize what their wish is. So, what do you think that you can do that as the society or association of the patients? Well, unless we do have the consensus, it is really difficult to come up with one voice. If we can't get the consensus, then the society would be divided into two parts. So I think it is important to let the patients understand. Well, so in the past, there are the voices that we have to go oppose to the genome test or that agree to the genome test. That's not the issue for these days. It is important to know or increase the knowledge about that. Otherwise, we can't discuss. So without knowing, once the discussion would be taken place, and then we may go to the wrong direction. So that we have to study and learn together. So before taking an action, we have to come up with the good understanding. So from the point of the understanding, education and training, well, I don't know whether the training or the education is, but the action to know is important. So among a few, well, in case that we may request, I believe that you would respond to give the lecture so that we can increase our understanding. Then Hamamura-san, for the increase of the patient's knowledge or in order to penetrate this kind of AI diagnosis support tool, then what kind of things that you can do as the private sector? Well, this kind of discussion has to be repeated in the various occasions, and also we would like to provide the places that we can exchange our ideas. And also, we do have the opportunity to collaborate with the media. We do have the various the media, not only for the TV or the other possible media, and we can utilize those the power, and that can be done by the private sector to contribute. Well, thank you very much. As you pointed out, the genome analysis and AI diagnostic support tool, with the words, the people may have the different impression, but diagnosis lag, it should be shortened, this lag, and we have to eliminate the diagnosis loss. Then if we say so, and then the patient can come up with the agreement. So if the purpose is clear, and we do understand what it is, well then we do understand the direction to go, that we should go, but the process has to be clarified. Otherwise, we come up with the anxiousness. So we have to consider together. Sorry to say, but each patient has to know, but that is important. But as was mentioned, the society has to understand. So, as an individual, it's not sufficient to understand by the individual, but the society has to understand. Otherwise, we cannot promote further. So, even though this is a rare disease, intractable diseases issue, the same thing can be applied. The patient themselves can understand, but the society don't understand. So, this is the common points. So in order to solve the various issues, we have to consider for the solution. Thank you. And as you pointed out, the family members and also the stakeholders has to be involved.
They can form a team, and then outside of that team, you have the general public. And it's rather difficult to penetrate understanding in the general public, and that may be the reason why we have a difficulty in having a better approach for the resolution of the diagnostic loss or diagnostic tool. In that situation, as Hamamura-san mentioned, we can make use of the media to let them think and talk about the diagnostic loss or tool. It doesn't have to be just rare diseases, but perhaps they can suggest some technologies and some easy practical examples which can be communicated to the general public. And then, as Ogura-san mentioned, some issues can be improved. Thank you. And finally,
医療データ収集と利活用。
I'd like to talk about the medical data collection and its utilization.
やはり我々もこのレジストリーというものをアスリートという組織の中でも
In the organization of athletes, we have the registry. We understand the importance of its usefulness. So, question to you, Dr. Yamano. The understanding on the part of the medical practitioners and the views among the medical practitioners, there may be varied. When the patient thinks about the participation registry, even before that stage, the doctors are not having a consensus in terms of the registry. What do you think, Dr. Yamano?
そうですね。
Right.
やはりいろんな事情があって、
There are different reasons behind,
代
but
をされているような先生
doctors who represent the working group,
がやっぱりこういう例作りたい。
in principle, they do want to form a registry,
いろんな事情があって、
but because of different circumstances, like economic circumstance included,
踏み出せない。
people may not be able to move forward.
運営本当にやっている。
Or the question is whether they can support this for a long time.
全部
When they are very busy, is it really possible to have a full support?
踏み込めない。
So there are certain situations and factors that make it difficult
そういうところ
for
まで
people to engage.
支援していくような体制
So we need a system to support all these and enhance the support.
結構やっぱり
And then as a result,
役に立つ研究したいっていう
people are,
ベースな
the researchers really are committed to
温度差を
carry out research and studies that can benefit the patients.
ご理解いただけ
But we hope that you also understand that there are reasons and the situations. So they are quite willing, but there are challenges. Yes, that's right.
多分そこを
And
支援できるようになればもっと
if we can provide better support, then this will be more widespread.
先生にお伺いしたい
So when it comes to the improvement, I have a question to you, Dr. Mito. You have many situations, reasons, and economic factors. One thing, there may be a technology that can be used for registry as a barrier. So the question is whether the government can provide a lot of budget and resolve this, or there are many other aspects as challenges.
レジストリ
Thank you.
がもう本当に大事だっていうのはも
The
う
importance of registry, I completely agree
ただまあ先ほど
to that. But as Dr. Yamano mentioned, when it comes to infrastructure and maintenance,
まあ時間も人手もかか
you
る
need people, you need money, and you need time. So
継続されているものが
there are registries that are being supported with the strong commitment and passion of the
小丸さんもおっしゃっている
medical practitioners. But as
それは
Grosso mentioned, this understanding of the general public is important. So it's a message. The patient organizations or pharmaceutical companies and media in the society, I think we need to speak up
いかないと多分
about the importance because if you run out of budget, then you just cannot continue running the registry, even if we are
今日の
passionate about it. So
ラグっていうことで
the diagnostic log is our topic today, and collection of data.
重要なのは
So diagnostic log
はもちろん
related data
集められ
is something that is important to gather before the
発症
diagnosis is confirmed. So when you think about the type of people that can develop the disease, there are different symptoms that lead to the diagnosis. So you need a lot of data in the pre-diagnostic period. People don't remember the symptoms in the past, and it's rather difficult however to cover all the population. Therefore, I believe that genomic testing is very important because people with high risk,
まあ日頃の
we need to
もしくは
have daily symptoms, some differences that occur on daily basis. If we have a system to identify them, then you can shorten the lag of diagnosis. And as we listen to the patient groups, we understand that although the patients are suffering themselves, they are quite passionate and contributed for the improvement of the entire patient population. So it's not just for the patient, the current patient, but we also hope to have a system that can provide betterment for the future patient. It's my daydream. So it shouldn't be just a daydream, but we hope to make it a reality. And in the rare disease, of course, unless you are diagnosed, you cannot join the patient group. So even in the rare disease situation, we shouldn't leave them behind, but we need to cover them in our discussion. That I think is very important. So Hamamura-san, if you can talk about the collection of medical data. It's not just the registry, but if you have any comment on the national registry, we'd like to get your comment. Thank you. When it comes to usage of medical data from pharmaceutical point of view, we talked about the data for drug discovery. That was major discussion we had in the past, but in the future, when we use more of the medical data, the data related to the existing treatment and the future treatment, we need to have a safe therapy. We need to have higher efficacy. We hope to have efficient usage of the treatment. And such data can also contribute to not just the current patient, but the future patients. We need to have a better analysis. And pharmaceutical companies really have to work hard for the effective therapy to the benefit of the patient, particularly in the area of rare disease. The collection of data, how the data is being used, including SAMD. We have so many things to cover, but MLW is promoting medical DX and the context of rare disease. If that is being included, this is not something that can easily be supported, but this is the area where we can get a big benefit out. So hope that with the support of the panelists here today, we hope to make this happen. Thank you very much. We need to make things conspicuous, and we should include that rare disease, intractable disease, in the government initiatives. And this, I think, will be a big approach for the improvement of the log and loss of diagnosis. So now that we cover these three topics, I perhaps like to get some input from you for perhaps we may have patients or stakeholders or the patient families, or none of these. You may fall into one of these, but the discussion we had, I think, is beneficial for all of us. Perhaps this may relate to you in the future, or this may relate to someone near you. Their disease may be something that you consider something that of your own, but hope that you would keep in mind about the diagnostic loss, and it's important that we continue to focus on a rare disease. So now I think it's time. This is the end of the panel discussion, and hope that we should have a continued discussion, and we'd like to take actions. And at this point, once again, I'd like to ask Ruth a very simple comment, just a simple impression of this panel discussion, please.
I think it's a very valuable discussion, especially right now we have AI technology and new technology about sequencing. So how to make the patient understanding the new technology and the limitation about that is very important. So I learned a lot from you guys. Thank you so much.
ありがとうございます。非常に素晴らしい価値のあるディスカッションを聞かさせていただくことができたと考えております。で、話に出てきたように AI の技術、それから新しい技術がどんどん進んでいく中、またその中の遺伝子の配列、シークエンシングなど、そういった問題の指摘もありましたけれども、これらを十分に理解すること、患者自身が、またその周りの人が理解をし、そしてどこに限界があるかということも十分理解していくということも大切なんだということを私は考えて聞かせていただきました。非常に有効だったと思います。ありがとうございます。
ありがとうございます。
Thank you very much. With this, we'd like to close this panel discussion. Thank you for your contribution.
ご登壇の皆様、誠にありがとうございました。
Well, thank you very much for the panelists. I would like the panelists to descend from the stage to your seats.
それでは最後に大阪
Lastly, I would like to ask Dr. Miyata, who is the producer for the event of the expo, the theme, the project that is the resonance of lives. Well, thank you very much for the excellent discussion. The patients, as Mr. Oguro mentioned, the various questions are raised, and from the various aspects that we have been discussing the points. The better co-being, that is the theme of this pavilion, and that is resonate to this discussion. As Oguro-san mentioned, by setting the same target is very important to solve the diagnostic lag so that the realization of the better treatment of the patients. And if I consider this, then that would be leading to the future patient, and also it is also contribute to the society.
まさにこれが
So
後でこのセッションをやっていただいた
I believe that this is the significance to have this kind of the discussion at the expo site. Those who are here with us, that not only for the co-being of with you, but for the other area, and also for the future generation that we haven't seen yet. By having the collaboration with them, to promote this concept. Well, some of you have visited just recently, but to this expo, but this the feeling or the theme has to be felt by your five senses. If you walk through the ring, and then within the ring there is a small earth globe, and then we are sharing the same sky. So that is resonates to the comment of Mr. Oguro, that is for the share the same target, and through the ring you may see the stars and the crystal, the same structure is to be made, but there is no same thing at all. The one is different from the others. By utilizing the new data without leaving anybody behind, we can further promote the future. So Osaka Kansai Expo, we are going to have a further 5 months to go. So I would like you to experience this expo and the significance of this meeting. Well, excellent discussion today. And I'm very grateful, and thank you very much for your participation as well. Thank you.